Good afternoon, everyone. I am Yatish. I represent Dr. Reddy's Foundation for Health Education. And my session is a antidote to the AI overdose you had since morning. Uh, Everybody is talking AI. Honestly, my understanding of AI is very limited. And I come from a field where we are uh, trying to retain the human-centric uh, efforts which the healthcare industry makes, and we want to propagate it and maybe repurpose it, uh, and ride the bandwagon of AI so that the patient centricity remains at the core of the healthcare. So that's how I have coined this session, missing piece of the jigsaw, patient centric soft skill training. From the morning, I was wondering how much redundancy AI is going to create in the healthcare industry. Okay, how much talent it will churn. Are we ready for this kind of revolution in a way? Okay, is the training department of a hospital or the healthcare industry, is it prepared? Because they have to train, retrain, and repurpose the entire healthcare human resource infrastructure. So let me go back to our background. So I represent uh, Dr. Reddy's Foundation for Health Education, and I am from the parent company, Dr. Reddy's, and basically our journey started this way. So molecules to medicines, and the journey is into health. And while this journey started somewhere, we wanted to collaborate with healthcare, and we said we have the best of the talent in Indian healthcare. How can we add value? Okay, how can we contribute? And can we pick up some small areas where we can support and enable? So, which are the pain points, or which are the, you can say, the term I'm using here is institutional void, because in your day-to-day transaction, there are certain things which take more of your focus and priority, and certain things get neglected. So, are there any areas or institutional voids where somebody else who can come and support? And which are those institutional voids? And can somebody, or in this case, can us help bridge some of those institutional voids? So, we 25, 30 years back, we started identifying some of them, and a couple of those institutional voids we picked up. One was health awareness. If there is ample health awareness, then more people would seek early treatment. The second one is nutrition and diet. Okay, so there is a lot of myth and misconception floating around, and a lot of damage is being done by WhatsApp and other platforms. And the third and the most important one, and what this talk is all about, is soft skills. So let me start with uh, the first of the three verticals or work streams which we are working on is called Awareness for Life. This is a program which we do in collaboration with corporate partners. We are partnered with nearly 1,000 plus companies in India, and PSUs, corporates, uh, in 350 plus towns in the country. And here, the doctors from healthcare fraternity, they volunteer as speakers. They go to particular corporate, they deliver a talk, say 40 minutes, 30 minutes talk. There's a lot of Q&A. They bust a lot of myth. Then they help in changing the behaviors. There's a lot of knowledge and information available. Okay, there's chat GPT. Everybody can Google about diabetes. Will that help the patient? No. What is needed is the right nudge and the right amount of fear, which will lead to the behavior change. Will chat GPT create the right amount of fear, or will it nudge for the right behavioral change? That can be done only by a human and an expert in form of a doctor. That's what happens here. And these are some glimpses of the program we do for white collared, blue collared across the country. And this is how we cover. Okay, we are creating awareness on different topics, industry by industry. The incidences, the diseases vary from, say, a KPO intensive city like Bangalore or Hyderabad versus an industrial belt like Kanpur. The topics which they are picking up is different, and we have doctors volunteering as speakers. Many of them have made this their hobby or maybe the mission. Some of them are doing a program every fortnight. These are some of our partner companies. So this was the first, you can say, institutional void, which is awareness, which we were targeting by active involvement of doctors who are volunteering and spending time and creating awareness, leading to behavior change. The second is that this is a very a new kind of intervention we've started. We are kind of supporting patients with the right clinical consultation in form of diet. Now, this again is an area where we are thinking, would Chat GPT replace dietitians in future? Okay, and there's a lot of exercise and activity, food engine, etc., is happening in the background. But the kind of permutation and combination which even a simple, say, a Kannadiga versus a Bengali patient with similar uh, kind of problems will throw up is going to require a lot of intelligence which you will have to build in the AI. I'm not an expert in it. Maybe some of you can uh, talk about that. So we have just started, and about 1.1 lakh patients and this different therapies we have consulted. A lot of variations are there, even in a state like UP. Okay, it's a state, but from Western UP to Eastern UP, the cuisine and the diet varies. Okay, so there is, say, a hospital in Hyderabad, which is a gastro hospital, and patients are coming from all across the country. So what kind of diet should a dietitian in say that hospital suggest the patient? So this is what we are doing, and patients can reach out to our platform, and the service is available in 12 different languages. A lot of counseling is done here also. Nudging and behavioral motivation comes into play. So which I think right now we are not there in form of a digital replacement. This was the second one, and now coming to the third and the core topic which I'm going to talk about. So there's a lot of churn happening. There's a lot of you can say investment happening in healthcare, and the expectation also is going up. And the expectation also is going up from the customers. So they are expecting hospitality and not cure or care. I was traveling with one of the colleagues from Hyderabad who is coming here for an event, and he is also part of the healthcare industry. And he was talking that hospitality industry, it's very easy, okay, but in healthcare, for patients to expect and for healthcare to provide, the gap is too much, or maybe our focus is not there right now on the care part of it. We are preoccupied with the cure. So, to summarize, we feel that there are four pillars of a world-class healthcare. One is the competent staff, for which obviously the hiring and training and retraining and continuous learning would serve the purpose. Standard operating procedures and how diligently they are followed, and the right investment in appropriate. I'm not saying it has to be changing every once in a while, because there's a capital which gets involved. But one piece which is neglected in prioritizing the four is soft skills, maybe, and that takes a back seat. Soft skills, sometimes people would trivialize it at just the bedside manners, or just how decently you talk and kind of greet the patient. But soft skill is an ocean in itself, and there's many elements beyond the basic stuff. So basically, we can categorize. This is just for a definition purpose. The core social skills, communication, teamwork, leadership, and the cognitive skills, situation awareness, decision making. Okay, task and workload management. Now, with the kind of attrition which healthcare industry has, and the spike in the amount of work which any staff in any particular domain is having, how do they manage the workload? Okay, that's something which has to be trained. Okay, it will not come uh, just by the attitude of it, or it's not kind of inherent. Okay, it is a trainable skill. So we have identified, okay, we call it doorman to chairman kind of skill mapping we have done. Okay, so we have programs for each and every staff level in a healthcare industry. Okay, from the security guards, the front office, the nurses, the technicians, the pharmacists, the junior doctors, the senior doctors, the HODs, the managerial cadre for that matter. And I picked up one idea that the IT team of healthcare, okay, we don't have program for them right now, but maybe in future we can come up with certain soft skills which would require. It is not a compensation for your core technical skill, but this soft skill is more like a lubricant which helps you deliver your kind of role better. Okay, and it helps you kind of navigate through the multifarious kind of requirement, collaboration, teamwork, project management, etc., which this new world will demand of you. So to start with, we have programs for every staff level, but most of the hospitals and most of the CXOs ask us to prioritize the nurses, and for the right reason, because if nurses are trained, uh, most of the burden of the hospital is taken care of. So we start with identifying what are the key training needs, which is not usually focused much on the regular training programs. And we have a program. So for each of the staff level, we have a name. So the program for nurses is called Abhilasha. And this is a 5-module program. Here we focus on the soft skills aspects like empathy, art of breaking bad news, feedback, handling angry patients, handling angry and irate family members, and the basic stuff like attendance, appearance, aesthetics, accountability. This is spread out over 5 modules, and there is a gap of 45 days in between where they practice. Now, you can say this can be done in the form of an LMS or a training program. We do all this in form of activity-based classroom sessions, where it's a group learning, where people come and share their own experiences. Sometimes it becomes very emotional when they are sharing their problems and pain points, which is normally not addressed. Okay, I don't think there is any hospital in India which is running at 100% manning. I may be wrong, but most of the cases we are seeing it at around 80 to 85% manning. In the sense, there is always a vacancy of 15 to 20%, and that burden is passed on to the people who remain in the system. And many of the nurses are working for 13 to 14 hours. Now, with that kind of, you can say, working hours, what would be the productivity of a person? Okay. So these are the programs which we do, and a lot of experience sharing is done. More of talking is done by the nurses themselves. They share their own problems, they share their own issues, and they kind of volunteer to share many of the pain points which they have gone through, and it has not been voiced in many of the forums. So this is like a catharsis for them. They are able to kind of bring out the elements which have been stopping them from delivering what they are meant to do. Okay, so the next one is front office. Now this is where the patient or the family member has the first interface with the hospital, and half the battle is lost here, because these team members are not trained in a manner where they are addressing the queries of the patient. Many of them don't maintain eye contact. They are not addressing the problem, the questions. They are not even suggesting the treatment alternatives. So we focus on this as one of the important pillars, and they are trained on telephone etiquette, greeting the patients, suggesting them the wider kind of treatment options, etc. And we feel that soft skill training acts as a shock absorber. So we have to keep training and retraining. This is something which does not have a fixed curriculum like you have for technical skills, but it's an evolving area, and we work along with the HODs of various hospitals, where they are able to kind of pinpoint and bring forward some specific training needs. So these are some programs in action, some visuals we have kept there. Sanjeevani is a program we do for pharmacists. Now, these are the busy lot. Okay, they are limited pharmacists in our hospitals, and they have to attend to the huge flow of patient, family members. Many of them don't understand the billing, etc. And there is a pressure for them to do the billing, get the medicines, manage the inventory, etc. So this is an overwhelming bit. Okay, and this is something which leads to what I call compassion fatigue. Okay, you say the pharmacist is not maintaining an eye contact, he is not explaining about the medicine, but we have made him so. We have made him so, but the workload is so much that there is no space for him to spend that 15-20 seconds extra to explain the medicine. And this leads to a lot of issues, like dispensing errors are there. It's not talked about, and we should talk about it if there are errors which are happening. So this program also leads to them voicing their pain points, their issues. Because their pool is usually limited to 5, 6, or 10 people, they are not the ones who are more vocal or heard of kind of team. Now, I go to the next program, which is called Prerna. Now, if the nurses are the most important pillars, we realize that the nursing leads or the nursing in charges are far more important. Okay, unlike in management where you have people 1:6 or 1:7 kind of ratio. In healthcare, somewhere we have observed even 1:15, 1:25 kind of ratio. One nursing lead, 25 nurses reporting into her. So there was a good nurse who did very well, and as a reward or as a recognition of her performance, you promoted her, and suddenly she is having to manage 25 people, which is very overwhelming. She was a fantastic star individual contributor, but now she is not a manager or a leader who is delivering. Okay, so we fill in this. We kind of bridge this gap in terms of lack of leadership training and time management, workload management, etc. Everything is trained, and lot of activity based sessions happen here between a good nursing leader and a not so good nursing leader. We compare and contrast, and many of them kind of do the role plays and do the games where they share their experiences. Moving on, we talked about the nurses, the technicians. So we have now the program for the junior doctors, the most busy lot. They have a lot of things to do, lot of things to attend to. They have to study, they have to do their bit in the hospital, and they have the other plans for the future. And this is where a lot of friction happens, a lot of medical legal cases, which we have seen happens in this bucket, and complaints regarding not breaking the bad news the way it could have been in a more sensitive manner, or dealing with the team, okay, not creating the right team spirit, or maybe a hierarchical based kind of behavior. So communication is important. And this is a nice quote from Robert Buckman I picked up. So, almost invariably, the act of communication is an important part of therapy. Occasionally, it's the only constituent. It is usually requires greater thought and planning than a drug prescription. And unfortunately, it is commonly administered in subtherapeutic doses. So, somewhere the softer aspect of healthcare is getting lost. And we have to make a consistent effort in a bunch of people who are getting driven and attracted by the sheer magnetic pull of things like generative AI to bring back the emotions. Okay, the emotions need to be brought back. So then we have program for senior doctors. This program like Manthan, where we talk about emotional intelligence, transactional analysis. See, we are dealing with the top 0.25 percentile of IQ, which you will have in the country. Okay, that's how they crack the examinations and reach where they reach. But when it comes to leading their team or maybe getting the best output from them, sometimes there is a gap. Okay, and the gap primarily is because the curriculum does not focus on the softer, the behavioral aspect of medicine. Okay, and that's where it's a teachable skill. Okay, a lot of people would brush it aside that this is a behavior which you bring from your birth or from your family, but that's a I would say misnomer. We can teach and train, and there are a lot of programs which are already there. So Manthan is a program on behavioral skill. Likewise, Mantra is a program on cognitive skill, and this program focuses on temperament for change. Okay, now when COVID happened, we assumed that the entire healthcare industry would migrate to telemedicine or teleconsultation, but about 15% did. Okay, what stopped them from migrating? Okay, this buzz of AI today. Is the healthcare fraternity ready for the migration? Do they have inhibitions? Who is studying that? And what is the effort being made to improve the temperament for change and believe that the AI can do real good things for the healthcare? Sanctuary is a program which is about stress management. It's a French word. Basically, we are all overworked. All of you sitting here right now, 5 people would be chasing you from outside. Somebody would be waiting for your approvals, or some meeting is to be rescheduled. Okay, so when I was a child, when I used to watch movies, I used to see in Hindi movies that the hero is standing there and the villains are coming. There are 25 of them. All of them are coming one by one, and the hero is touching them and throwing them away. But all of you are professionals. The villains don't come sequentially. They are not that decent. Okay, they will all come together. So the multitasking is needed from you. You would have to attend to 5 different things of equal priority, and then your boss will come and say 2 more is there, and his boss will come and add 2 more. So basically 7, and then you need to prioritize. Will AI help you in that? You will have to do it yourself. Okay, till there is a tool. And the highest form of knowledge we think is empathy. We have a program called Samanubhuti, which we developed. So all these programs get triggered when we have conversations. So we visited a cancer hospital in Delhi, and right after their board meeting, and they mentioned that the mandate from board is focus on this one word, empathy. Okay, and we created this program called Samanubhuti. Basically, it deals with compassion fatigue. All of us in healthcare at a point of time become cold. Compassion fatigue sets in. There is no effort made by anybody to kind of revive, even to acknowledge that there is compassion fatigue. Okay, so this is what we focus on. We have to acknowledge it and work on it, and this is done through inventories. Nobody comes and teaches you how to be empathetic. Okay, you discover yourself through a tool or psychometric assessment that there is a gap area. Final program, which is called Sayog, that this came from a discussion with a CEO, and he said, thanks, you have trained all my functions. They are very well groomed, but what I have a problem is they keep fighting amongst themselves. Okay, I don't need competition outside. There is enough competition within the hospital. So the purchase keeps fighting with the medical with nursing with other department, with finance, and all of them are at war. Okay, so do something to bring them together. And this is a program where we bring in people from different functions, different departments, make them sit together, and they create a roadmap or a culture of collaboration which is customized to that particular hospital. So to end, these are the kind of feelings which the patient should carry. And if we have been able to achieve through our care in form of the knowledge, the skills, the technology, the infrastructure, or the soft skill which the team is trained and retrained continuously on. And these are the words which the patient should take back, that when I went to that hospital, I left with a feeling of compassion, trust, safety, reassurance, being heard, being respected, empowered, caring, warm, or fond memories. They will not perhaps take back the Zigmo in form of a robo, which came and did some fancy stuff. So we have started to venture into quality management and infection control, because that also is an area we felt. But more or less for 20 years, we have stayed very focused. One niche area, soft skill, we want to reach. It's an ocean in itself. There's a lot of dimensions to it. But we are trying to do whatever we can in our bit. And gradually, we have been able to bring in this consciousness from what was considered as a softer, nice to have, theek hai kar lo kind of programs, to well-structured, well-designed, integrated kind of soft skill training program, which will help people to manage their workload better, help in right decision making, do the right situation awareness in critical kind of situation, and give the patient the right kind of quality of healthcare. So we are very happy to collaborate. These are programs we are doing. Nearly 1,000 plus hospitals we are working across the country. Most of the hospitals here, some year or the other, we have done a lot of training programs for you. I'm not sure if somebody is missed out. We'll be happy to work with them. And this is what we have done. In our journey, we have trained nearly 2.75 lakh nurses, roughly the 10% of the nursing strength of the country. 2 million would be the rough number. 35,000 pharmacists, and nearly 96,000 physician assistant, and about 67,000 doctors. So that's it, and would be happy to collaborate, hear from you. This is my contact details. If you have any questions, or we can connect during the tea. Thank you.